My name is Dawn Long. I am a student in the RN to BSN program at the College of Nursing at St. Petersburg College. The purpose of this video is to provide nurses with an in-depth coverage of rheumatoid arthritis. Rheumatoid arthritis is a long-term systemic autoimmune condition marked by ongoing inflammation that causes joint pain, swelling, and progressive damage to the synovial joints, often resulting in disability. The objective of this presentation are to explore RA, including pathophysiology, impact on the U.S. population, etiology and risk factors, clinical manifestations and related complications, treatment, and nursing evidence-based practice. RA is a chronic autoimmune condition that affects about 1.5 million people in the United States. RA impacts women more than men. Around 1.13 million women live with RA, compared to 375,000 men. Beyond its personal toll, RA has a significant economic burden, costing society an estimated $46 billion annually. This includes healthcare expenses, lost productivity, and long-term disability. Rheumatoid arthritis itself will not directly cause death, but it can take a toll on life expectancy. On average, people with RA live about 5 years less than those without. This is largely due to disease severity, comorbidities, and patients' overall functional capacity. The good news is there has been real progress made as RA-related death rates are going down. This is in part due to early diagnosis and better treatment. These days, with the right care and healthy habits, many people with RA are living long and active lives. The exact cause of rheumatoid arthritis is not fully understood, but is believed to develop from a mix of genetic and environmental factors. The most widely accepted idea is that RA is an autoimmune disease. In people who are genetically more likely to develop RA, this immune reaction might be triggered by an unknown antigen, possibly a virus or bacteria, although no specific organism has been confirmed. This trigger causes the body to produce abnormal immunoglobulin G, IgG. In response, the immune system creates antibodies known as rheumatoid factors, which mistakenly target the abnormal IgG and spark a cycle of inflammation. Some say their symptoms begin after a stressful event such as illness, childbirth, or emotional upheaval. However, no direct link between stress and the onset of RA has been determined. When we talk about risk factors for rheumatoid arthritis, 5 main contributors stand out. Autoantibodies. The presence of anti-citrulline protein antibodies, ACPA, is one of the strongest predictors. These can appear in the blood years before any joint symptoms and expand over time. Genetic predisposition. A family history of RA and certain genes increase susceptibility. Cigarette smoking. Smoking, including exposure to secondhand smoke, triggers inflammation, weakens the immune system, and can contribute to the development of RA. This is the most prominent lifestyle-related risk factor, especially when combined with genetic risks. Sex and hormones. RA is 2 to 3 times more common in women, likely due to hormonal and immune regulatory differences. Rheumatoid arthritis is believed to be an autoimmune disease where the immune system mistakenly attacks the lining of the synovial joints, leading to erosion of bones and cartilage as well as joint space narrowing, as seen in the images to the right. This usually starts in people who are genetically prone and are exposed to certain environmental triggers, possibly an unknown infection. The immune system produces an abnormal IgG, which triggers the creation of a rheumatoid factor. These form an immune complex that build up in the joints, leading to inflammation. Immune cells like neutrophil and T helper cells are activated. They then release enzymes and inflammatory cytokines like tumor necrosis factor, TNF, and interleukins, which over time damage cartilage and bones. Some patients notice symptoms begin after a stressful event, but there is no clear evidence that stress directly causes RA. Now we discuss clinical manifestations. As you can see from the image to the left, RA can affect many parts of the body. RA usually starts with joint pain and tenderness, especially in small joints like the fingers and wrists. The pain comes from the swelling, which puts pressure on the joints. As the disease progresses, the pain can get worse, especially when changes in the bones occur. Basically, new bones forming where they shouldn't. Along with the pain, stiffness is a big issue, especially in the mornings or after sitting still for a while. Another major sign of RA is joint deformities. Over time, the ongoing inflammation can cause the joints to become visibly deformed, and it can be painful. A few common ones include ulnar deviation, where the fingers start to bend towards the pinky, and boutonniere and swan neck deformities in the fingers. You might also see hallux valgus, where the big toe starts shifting towards the other toes. RA is not just limited to joints, it can impact the whole body. Around 50% of people with RA develop something called rheumatoid nodules. These are lumps that typically form over elbows and fingers, but they can also invade internal organs like the heart, lungs, and spleen. This can cause issues like heart valve deformities, pleuritis, or even pulmonary fibrosis in the lungs. Now let's talk about some of the complications. While we know it's a disease that affects the joints, it has a much broader impact across the body. As the disease progresses, you may see flexion contractures, meaning joints can get stiff and lose range of motion. If untreated, this can lead to permanent loss of motion. Plus, because the joints aren't moving right, muscle mass around them starts to waste away. All of this ultimately leads to loss of mobility, making everyday tasks difficult. RA also causes excessive inflammatory exudate, which is the buildup of inflammatory fluid. This can cause cysts to form in the articular cartilage or even in the bone. RA can lead to acute necrotizing vasculitis, which is inflammation in the blood vessels. This inflammation can damage tissue and affect blood flow. In serious cases, blood clots can form, which can result in heart attack, stroke, or even mesenteric infarctions, where part of the intestine dies due to lack of blood. Another common issue is Raynaud's phenomenon, where blood flow to the fingers and toes is restricted. Muscle atrophy is common. This happens when muscles aren't used properly and start to waste away, which in turn makes the joints even more unstable. Disease-modifying anti-rheumatic drugs, DMARD. Now let's talk about DMARD, the main treatment for RA. These drugs don't just relieve symptoms, they help slow down the disease and prevent long-term damage. Methotrexate is usually the first choice. It works by reducing inflammation and suppressing the immune system, which helps prevent further joint damage. The key with DMARD is to catch RA early and start treatment quickly to prevent joint damage. Surgery for RA. Sometimes, despite medications, RA can cause so much joint damage that surgery is needed. The two main options are synoviectomy, which is removing the inflamed tissue from the joint to reduce pain and further damage. This is recommended in early stages of RA when joint destruction is minimal. This type of surgery is performed using general anesthesia or a regional nerve block. After recovery, most patients see reduced pain and swelling. Joint replacement. If the joint is too damaged, replacing it with an artificial joint can help restore function and relieve pain. The surgery is often performed on joints like the shoulder, hip, and knee of RA patients. This surgery is performed under general anesthesia or spinal epidural. Surgery is usually at a last resort when other treatments haven't worked, but it can make a big improvement in the patient's quality of life. Now let's discuss nursing care recommendations for patients with rheumatoid arthritis based on recent findings by Zaki and colleagues in 2024. As we've discussed in this presentation, rheumatoid arthritis is a chronic autoimmune condition. This study evaluated the impact of a structured 12-week nursing protocol on RA outcomes, and the results showed significant improvements in both physical and emotional health. As nurses, we play a vital role in helping these patients manage their condition. One of the most important aspects is patient education. We must provide clear instructions about the disease process, medication, side effects, and self-care strategies like joint protection and exercise. Educating patients helps them understand their condition and reduces fear and confusion. Next, we need to promote self-management. This includes teaching patients how to stick to their medication regimens, monitor symptoms, and make healthy lifestyle choices. We can empower them with tools like symptom journals or apps to track their pain and mobility. RA also impacts mental health. Many patients experience anxiety and depression due to chronic pain and limited mobility. That's why psychosocial support is essential. We should regularly assess emotional well-being and refer patients to counseling or peer support groups when needed. Finally, RA management is most effective when we take a collaborative approach. Nurses should coordinate care with rheumatologists, physical therapists, and social workers while also advocating with the patients for their needs. In summary, structured nursing care that includes education, self-management support, psychosocial care, and coordinated care can greatly enhance the quality of life for RA patients. This study provides strong evidence that nursing interventions are not just supportive, they are essential.